Pakistan عن Bibliometric Analysis of Pharmacy and Pharmacology Research in Pakistan. أين تقف باكستان بالنسبة للعالم في الأبحاث الصيدلانية والدوائية؟ في عندنا Bibliometric Analysis of Citations and Cited Frequencies of Pharmaceutical Care and Research من 2002 ل 2013 في الصين. يعني التشاينيز حابين يعرفوا كم الصيادلة في الصين أو الأكاديميين أو الباحثين أو البروفيشنالز they care about pharmaceutical care and application of pharmaceutical care to the profession of pharmacy in China. لأنها واحد من البوابات المهمة نحو globalization. مثال ثالث community pharmacy based research activity in India. نفس الشيء. الجميع عماله بيحاول إنه يبحث where the country stands in a particular field, whether it is medical or pharmacy or any other field. كمان مثال a bibliometric review of pharmacy education literature in the context of low to middle income countries. يعني if we want to globalize the pharmacy education, let's see how many articles العالم العربي أو العالم الدول الفقيرة has published in this field. لأنه أنا ما بقدر أعرف في كل مكان شو بصير في التعليم الصيدلاني unless I got the point of view of the academicians who wrote about this. هلا بكل بساطة شو اللي احنا عملناه؟ What we have done, we used database اسمها سكوبس، والسكوبس فيها حوالي 23,000 journal. It's a big, huge database. We used specific key points, specific keywords. هذه الكيوردز هي عبارة عن كلمة community pharmacy or community pharmacist حتى نوصل للأبحاث اللي انتشرت في مجال الكوميونتي فارماسي أو كوميونتي فارماسيست. هلا عالميا لغاية سنة 2014 عدد الأبحاث اللي فيها كلمة كوميونتي فارماسي أو كوميونتي فارماسيست world wide كان عددها حوالي 7364 document. هلا معظم هاي الأبحاث منشورة في المجلات اللي لها علاقة بالفارماسي براكتس زي Pharmaceutical Journal, International Journal of Pharmacy Practice, Pharmacy World of Science, Research in Social and Administrative Pharmacy, Annals of Pharmacotherapy اللي هي the leading journals in pharmacy practice. لما سألنا حالنا worldwide ايش هي الانستتيوشنز اللي are leading the world in community pharmacy practice؟ رح نشوف انه بكل بساطة the University of Sydney, Australia, is the most productive institution regarding publications in the field of community pharmacy, followed by University of Manchester in UK, followed by University of Wisconsin Medicine. Those institutions are very active in community pharmacy research and they are producing almost 1/3 of publications in the world regarding community pharmacy. If we look at country level, we will see that the United States is number 1 in producing articles and research regarding community pharmacy, followed by United Kingdom and followed by Australia. If we look at this graph, which has been extracted from Scopus, you will see that there is no Arab country here in the list in the top 10 countries producing research in community pharmacy. Malaysia came number 10, which is good because the Malaysian people are moving toward more social and community pharmacy and they are reforming the pharmacy profession from zero. If we look at what are the main topics that the whole world is publishing about when it comes to community pharmacy, the hottest topic were compliance and medication adherence, and the guy from Italy said in this morning that they do care a lot about the role of pharmacists in improving medication and adherence and compliance because it saves a lot of money, it has therapeutic implication. So the topic of medication adherence and compliance has occupied a lot of space in the world of community pharmacy research, followed by the role of community pharmacists in screening. There is a lot of research about the role of pharmacists in diabetes screening, in cholesterol screening, and hypertension screening. And thirdly, one of the hottest topics is the medication errors and how pharmacists can play a role in in finding and detecting medication errors. And number 4, the community pharmacy services. What kind of new services that community pharmacists can offer to improve the profession? Now we came to the Arab world. I did the same methodology, but now I use the list of the 22 Arab countries up until 2014, and the whole number that we produced as research articles is 174 published articles about community pharmacy. And if you see the figure, research in community pharmacy and publication in community pharmacy in the Arab world started after year 2000. Regarding the worldwide productivity, community pharmacy research started as early as 1980. So we are almost 20 years delay or later than the whole world in producing or doing community pharmacy research. If we look at what journals do the Arab world publish in their research in community pharmacy, we will find Saudi Pharmaceutical Journal, which is a regional journal, is the one that published most of the community pharmacy research from the Arab world. Of course, researchers do publish in other journals like the International Journal of Clinical Pharmacy, Pharmacy Practice, and others, but the leading journal was Saudi Pharmaceutical Journal. If we look at the institutions, what are the most productive institutions in the Arab world regarding community pharmacy research? Number 1 was King Saud University, followed by Qatar University, and in the 3rd rank came Al-Qasim University. Of course, جامعة العلوم في ماليزيا أجت رقم 1 لأنه معظم الأبحاث الصادرة من الوطن العربي في مجال الكوميونتي فارماسي has been in cooperation with the University of Malaysia. This is very good that على الأقل جامعتين من السعودية يجين في أول 3. جامعة قطر مع أنها جامعة relatively young, very young, لكنها أجت رقم 2 which is very good. إذا بنطلع بعرفش وين ممكن تقع جامعة أو الجامعات الأردنية. I hope إنها تكون هي 5 يا حشمات أو whatever، إنها تكون من الأوائل أو من the top 10 institutions in community pharmacy research. لما جينا سألنا عن what are the Arab countries that actually produce community pharmacy research، السعودية أجت في المركز الأول followed by Qatar and United Arab Emirates. يعني واضح إنه الخليج is reforming the pharmacy profession. If you need to reform the pharmacy profession, you need to do research about واقع community pharmacy and what is your future look about this profession. هلا جينا سألنا طيب في الوطن العربي what are the top cited articles in community pharmacy؟ أول و the most commonly cited article من الوطن العربي about community pharmacy كانت لدكتورة ميادة من الجامعة الأردنية about OTC. واضح إنه ال over the counter medications في عندنا something important regarding the use, regulations, and perspective of the society regarding OTC. So OTC is an important topic in community pharmacy research in the Arab world, followed by things like self-medication, and it seems that we avoid contact with physicians and most people go to the pharmacist, which is good and bad. Good because it indicates that a pharmacist is on the first line to meet the patient, and it might be bad if the pharmacist is not well educated to give the good counseling. The other thing that is also commonly encountered in research from Arab countries is the misuse of antibiotics. And actually it is a common problem that needs to be reformed, that needs to be restudied in order to catch up with the global standards. As a conclusion, بكل بساطة, if we need to catch up, if we need to go global, we need first to understand where we stand regarding all aspects of pharmacy profession, whether it is clinical pharmacy, community pharmacy practice, whatever it is. And this cannot be done unless you do a basic bibliometric study to know where are the weaknesses and the strength from the academic point of view. And the second point, you need to involve the academicians in reforming the pharmacy profession. The academicians, they have more contact with science, deep thinking, critical thinking, global look, that might add more to the profession than just only the Pharmaceutical Association. Thank you.
We have time for one or two questions.
Thank you, Dr. Walid, for this amazing presentation. I really enjoyed it.
احكي بالعربي. ما انت من قطر، احكي بالعربي.
بحكي من قطر بس شوي عربيات لما بحكي
حتى ولو بندربك عربية.
اوكي. شو كنت بدي احكي؟ يعني كثير كنت سعيدة بالبرزنتيشن اللي عملتها و I think it's a really important it's a really important topic to talk about community pharmacy. I was quite impressed to see, and I like a new Qatar University will be one of the leading countries in the Arab world in terms of community pharmacy. And there has been quite a lot of changes and advances and a lot of investment from the Supreme Council of Health in Qatar. They feel the community pharmacy has been neglected and there is a lot of investment that is going on to try to advance community pharmacy. Our graduates, when they graduate, most of them go to the hospital, they work in the hospital, which is contrary to Western countries where when graduates, they go to the community pharmacy, maybe about 80% would go to community pharmacy, whereas, in Qatar, it's, the opposite. And I know a lot of our students would love to go and work in community pharmacy, but still the interest, there need to be quite a lot of commitment and hard work in the infrastructure within the community pharmacy. So it was really interesting to see, and I think this is an area that is neglected, and we really need to work more on it to advance it. Thank you so much.
يعني لا استطيع ان اخفي اعجابي بجامعه قطر، يعني انا واحد من اللي فاسينيتد بالاتشيفمنت اللي عملتها جامعه قطر في مجال الصيدله، سواء accreditation, change of profession, publication، بلا شك انه you made a big step forward.
يعطيك العافيه دكتور وليد. شفت انا استغربت يعني I was surprised انه occupied Palestine coming before Egypt. يعني Egypt مصر 90 مليون بهالكليات والجامعات العريقه القديمه، شو المشكله؟ يعني حاولت انه تفكر في الموضوع شو المشكله؟
مثل ما حكت الدكتوره الاء هو it's culturally انا I think انه community pharmacy is a neglected profession and neglected as a research topic. في مصر it seems very neglected. بجوز فلسطين في research groups they start to realize انه social pharmacy, community pharmacy عندنا في فلسطين وحتى بالاردن they have many drawbacks. وانه if we reform them we can add up to the profession بشكل ايجابي. انا معك، انا تفاجأت من وضع مصر، فيش زملائنا من مصر. يعني ممكن احكي بحريه؟
Egypt is more medical.
Maybe. Actually, in many subjects related to pharmacy, Egypt was not the leading. But when it comes to medicine, urology, ophthalmology, it is leading.
إذا ممكن أعلق، يعني أنا معي المايك لازم بقدر أعلق. قواعد البيانات اللي أنتم درستوها كانت mainly scopus، صح؟ Sometimes maybe it is the way they publish their papers, maybe one of the issues that have to be addressed. يمكن ما عم ننشر بقواعد البيانات العالمية. يعني أنا بعرف معظم المصريين ما يعني بينشروا بمجلات محلية، ما بينشروش بمجلات عالمية.
This is a drawback. This is a drawback. يعني it is good always to publish in at least Scopus index journals حتى international readers to read your publication. And the local journals that have very low negligible impact, they will not change the profession.
Thank you. The next speaker is Dr. Ramzi Shawahna. Dr. Ramzi has got his PhD degree in pharmacology 2011 from the University of Paris. He also got postdoctor from Emory University, USA. He is now assistant professor in Al-Najah University. His research interest is medication errors, and this is reflected on the title of his speak today, which is Definition of and Scenarios Representing Medication Administration Error Situation, a formal consensus method.
Thank you very much for giving me this opportunity. I'm really excited to be among you. Today I'm going to present a project which I did with my undergraduate students as bachelor thesis, and fortunately they could write it in a manuscript format, which is now luckily accepted in the Journal of Clinical Nursing, which is going to appear in a month or two in their next coming issue. Yeah. So, I'm going to click it really fast just to save you some time. Medication error administration errors are common, and in general, medication errors are common in different healthcare systems around the globe. Medication errors can occur at any stage during the processes of medication prescribing, transcribing, dispensing, administering, or monitoring a medication. Indeed, the medication errors that harm occur when the drug is actually administered or omitted from administration to the patient concerned. So, in hospitalized patient settings, usually nurses administer medications. Therefore, it's most likely that nurses would commit errors. So, if we look here, nurses who commit errors would probably face blame, warnings. It might go to disciplinary action, litigation, lawsuits, and termination of employment. So, we came to the question, what constitutes a medication administration error? So, looking at the literature is quite confusing, because when you look at different studies, there are a lot of inconsistencies. Since direct observation is the gold standard in analyzing for medication administration errors, so researchers rarely tell you what they were looking for. So defining medication administration errors is a prerequisite step in analyzing for the incidence and prevalence of medication administration errors, of course. So when we looked at the literature, we found that the practitioner-led definition of medication administration errors was not previously approached using a formal consensus technique. And that's what we did. The objective of this study was to develop and achieve formal consensus on a definition of medication administration errors and the scenarios that should or should not be considered as medication administration errors in hospitalized patient settings. So when I say hospitalized patient settings, I mean hospitals and nursing homes. So for this study, we used Delphi technique, which is a common technique used in formal consensus reaching or for reaching formal consensus. So we contacted 8 experts in the domain, and we interviewed them for their opinions on medication errors. So we asked them to define medication administration errors and to give all potential scenarios for medication administration error situations. At the end of this stage, which is called opinion generating round, so they give definition similar to the definition used by Allen and Baker with some expansions. These expansions permitted the evaluation of medications administered intravenously. So we again looked at the literature and we extracted all potential medication administration situations, and we used the purposive sampling technique to recruit 50 experts in the domain, and we conducted a successive rounds. So all these potential medication administration error situations were formulated into scenarios. These scenarios were included in the questionnaire. We had a definition for medication administration errors, and we had a total of 61 scenarios, or different scenarios. So we presented these scenarios to the experts, and experts had to indicate the extent of their agreement or disagreement with each scenario on a scale of 9. So this agreement occurred when the median score fell between 1 and 3, with an interquartile range from 0 to 2. Agreement was said to occur when the median fell between 7 and 9, and the interquartile range expand the range from 0 to 2. When the median fell between 4 and 6, with interquartile range with more than 2, it was said to be equivocal. So all equivocal scenarios underwent a third round. Here I'm presenting the demographic details of the 50 experts. So we can see that we had both genders represented. We had different age groups. And again, the qualifications of the experts ranged from diploma in nursing to PhD in nursing. The employers were public hospitals, private hospitals, nursing schools, universities, and teaching hospitals. Again, experts were of different, had different positions and different ranks. And again, their experience ranged from 5 to 30 years. So, when we come to the definition, a medication administration error is a deviation from the prescriber's medication order as written on the patient's chart, manufacturer's preparation, administration instructions, or relevant institutional policies. So, experts agreed to accept the definition, and the median score was 8 with interquartile range of 2. The response rate in the second round was 100%, which means that 50 experts took part and voted. In the second round, in the third round, the response rate was 88%. So, at the end of the study, 50 scenarios were included as medication administration errors. 3 scenarios were excluded, and 8 scenarios remained equivocal. So I'm here just presenting some examples of the situations or scenarios which were considered as medication administration errors. So the scenario as an example, because we have 61 scenarios, of course, I cannot present them here in 15 minutes. So a nurse failed to verify the patient's identity, for example, wristband worn by the patient to ensure correct patient had administered a dose of medication that was due for another patient. The scenario was accepted in the second round with a median score of 9 and interquartile range of 1. Another example is the nurse failed to check the allergy pad or allergy information written onto the patient medication administration record and administered a dose of medication to which the patient had allergy. An example of the scenario that was excluded or rejected by the experts, a nurse failed to administer a whole dosage unit and instead administered 2 halves of the same dosage unit. For example, a medication order was to administer 500 milligrams of amoxicillin, for example. The nurse didn't have 1 tablet of 500, so she administered 2 dosage forms containing 250 at a time. And this is an example of the scenarios which remain equivocal, which means to be considered or not depending on the individual clinical situation. So a nurse failed to administer a dose of medication based on her or his professional judgment. So it depends. It depends on the individual situation to be considered or not. So we can see here that the median score was 4 with interquartile range of 5 in the second round, and in the third round, 6 with interquartile range of 4. So in conclusion, what this work contributes to the wider global clinical community. We can conclude that using formal consensus techniques can be applied in medication administration errors to reach or to come up with definitions and different scenarios that should or should not be considered as medication administration errors. And again, we have to remember that if researchers use different scenarios, so we cannot compare their results. So in the first place, they have to use the same situations, same scenarios in order to be able to compare their different results. At the end, I would like to thank you for your attention. I would like to thank my students, Dina Masri, Rawan, Araba, Rawan Dik, Lama Daiba, and Masahba. And thank you very much for listening.
Any question? We have some time. Okay, I have a comment or a question. This definition may be from the medical point of view. Did you try to see the definition legally in the law? Because these errors can produce harm to the patient, and it will be a legal matter. So, what is the definition by the law?
Well, actually, we reviewed all the definitions in the literature. I don't think there is a definition by the law what is a medication administration error. So there has been like different definitions, from simply a deviation from the prescriber's order to a detailed definition including like different situations which could be included as medication administration errors or not. So I don't know if there is a legal definition of what is a medication administration errors.
Another question?
Thank you, Dr. Ramsey. I would like to ask, how do you track or follow up the medication errors from maybe level 1 to till 12, level 12 degrees or levels of medication errors, as I know? How do you track them? Do you report them or not? Do you have system for reporting of these medication errors? And what are the actions taken either by hospitals, by the authority in Palestine? This is my question.
Okay, thank you very much for your question. Actually, we didn't do that research. Our research was focused on what is a medication administration error. If this situation should be included as a medication administration error or not. We did not see any medication error. So this is the preliminary step or a prerequisite to conduct a further research in the domain. So we didn't do that. Thank you very much.
you can't
Sure.
يعني انت قلت ان احنا ما بنقدر نقارن الميديكيشن ايرورز اللي موجوده عندنا مع الميديكيشن ايرورز somewhere else because we have different scenarios. But you started your talk that you extracted the medication errors والscenarios من literature. So
Yeah.
basically يعني في بيس ممكن نقارن فيها ولا لا؟
لا.
لان انا مش
اوكي مش مشكلة، لا القصة كانت انه حتى لو كان في عندنا دراسة بتقارن بين مستشفيين او مركزين صحيين او تو هيلث كير سيستمز، لنفرض انه السيستم الامريكي او البريطاني او اي شيء ثاني. هلا اذا ما استخدمنا نفس السيتويشن، لانه بالعادي الناس اللي بتدور على ميديكيشن ادمنستريشن ايرورز تستخدم دايركت اوبزرفيشن. اوكي، كل ما شافوا خطا بيعدوا. تمام؟ هلا اذا ما كانوا يدوروا على نفس الشيء حتكون النتائج مختلفه. انا ممكن ادور في المستشفى على مثلا تايمينج ايرورز، على دوز ايرورز، وما اشمل الاذر كاتيجوريز. هلا احنا لو تفرجنا على الليترشر وشفنا شو ممكن الناس كانت تتفرج، وطلعنا في سيناريوهات مختلفه لاي شيء ممكن يكون administration error او لا، وبعدها عرضناها على البنات.
Thank you. Thank you very much. البرزنتيشن الأخير وليس آخرا من الدكتور قصي الشاهد. دكتور قصي he is a graduate from the University of Just bachelor degree, MSc in clinical pharmacy from Najah University. His talk is going to be about the safe disposal of medicines in Palestine. تفضل دكتور.
Okay, thank you. Good evening for all. Many thanks for the Iconic University and the Lead University for hosting this conference. I will talk about safe disposal of medicine in Palestine أو التخلص الآمن من الأدوية منتهية الصلاحية أو الغير مستخدمة. أجرينا دراسة بسيطة في مدينة نابلس في شمال الضفة الغربية ولا راح نحكي عنها، وأقدر أعطيك إن شاء الله introduction بسيط على الكونسبت تبع السيلف ديسبوزال of medicine in Palestine. Okay, as we know, medicine play an important role in treating many conditions and disease. When they are no longer needed, it is important to save or to dispose of them, probably to help reduce harm from accidental and or intentional misuse. Food Drug Administration worked with White House of National Drug Control Policy, United States, to develop the first consumer guidance for proper disposal of prescription drugs. This was issued in February 2007 and updated in 2009. There are many steps for disposal of unwanted medicine, of expired medicine, regarding to FDA and CB, regarding to also a drug enforcement agency. Why safe disposal of medicine? Why we talk about it? Why all the world interesting in this topic? Okay, and safe disposal of medicine may damage to sewage systems and septic systems, environmental impact. Also, accidental ingestion by children and elderly, or illegal use. أو كثير بنسمع كمان مريض شفي من دواء سمع زميله أو صديقه أو أخوه خذ هذا الدواء. طب ما هو الدكتورز بيكون لما يكون كل واحد عنده كونديشن معينة regarding to symptoms, regarding to specific disease بنعطى الميديكيشنز. So they found trace amounts of pharmaceuticals in water system, groundwater. so mainly due to natural elimination from the body. Our study, the aim or objective of our study was to look closely at the practice, attitude of patients' cares in Nablus, in West Bank, Palestine, with regard to disposal of unwanted or unused, expired medications. The methods, the study was cross-sectional survey, administered via face-to-face, structured interview with randomly selected patients, community pharmacists, and physicians from Nablus. There are limitations in our study, such as many pharmacists or pharmacy owners refused completed or taking part of our questionnaire. And some participants will answer part but not all questions. Hospitals agreed to conduct the study with patients but not staff, especially pharmacy department. The study sample was small and could not get official data from Ministry of Health regarding actual collections from pharmacies. Okay, survey population, 250 cares completed questionnaire. They were almost of them or المشاركين كانوا أقل من 40 سنة and they had first degree of university, first university degree, sorry. Okay, results in briefly here. تقريبا 50% سألناهم ليش بدكوش هاي الأدوية أو ليش بدكم تتخلصوا من الأدوية. فكانت الإجابة إنه was possessing expired ones. كمان 78% ما شافوا أي إعلان advert في الفارماسي وتشجعهم إنه نعمل take back بروجرام للفارماسي والفارماسيست يسموهم للمنستري اوف هيلث. بالإضافة 75% و 74% بيعتقدوا إنه الانdirect disposal of self can impose illegal and environmental hazards زي ما حكينا ليش بدنا السيلف ديسبوزال. بالإضافة 95% have not been directed for self-disposal of medicine. 74% بيعتقدوا انهم بدهم education سواء كان من الفارماسيست من المينستري اوف هيلث ولا راح نحكي عنهم. بالاضافه كمان 46% بيعتقدوا انه الناشونال كامبين هي الموست ابروش والوسيله الصحيحه للتعلم كيفيه التخلص من الادويه. زي ما احنا شايفين كان النسبه الكبيره سالناهم ليش بدكم تتخلصوا من الادويه. اجين لقينا الاكسبيرت ميديسن النسبه الكبيره انه بيقولوا 51% عشان تخلص فعاليه وصلاحيه الدواء. كمان في منهم انه اكسب ميديكيشنز موجوده في الكابينت تبعت الدواء في البيت، ومنهم change او discontinuation الدواء بدل الطبيب من دواء لاخر، ومنهم self discontinuation. بس بنلاحظ النسبة الكبيرة 51% انه السبب الرئيسي للتخلص من الادوية هو الاكسبير ميديسن. طيب تقريبا النتيجة هون راح نقرأ انه الميثودز respondents used to dispose of unused medicine او الاكسبير ميديسن اللي لقيناهم throw them في الدستبن، ونسبة كبيرة كانت 66%. وجدنا كمان ورحنا على الليترتشر لقينا كمان في كندا نفس الكلام، ربع الكنديان برضه disposed of unused medicine throw them in dustbin. وبالإضافة كمان في دراسات في الكويت وماليزيا. في منهم كانوا يقولوا 14% رجعنا أدوية غير مستخدمة أو المنتهية الصيدليه، ومنهم بيعملون فلاش داون تواليت اور سينك. وهذا كثير مهم هذا الكلام، انه نخاف على الجراوند ووتر. اوكي، سالناهم كمان مين متوقعين يكون الريسبونسبل او الميجر ريسبونسبل فور unsafe disposal of medicine. كانت اجابه المشاركين 250 مشارك في هذا البحث انه 53% بيقولوا مسؤوليه وزاره الصحه بشكل رئيسي. في منهم قالوا برضه بتعلق الامر بمسؤوليه المريض 30%، وفي منهم قالوا 10% على الصيادله ووسائل الاعلام. طيب كمان بالاضافه سالناهم البيست ابروش فور بيشنت education. كان الجواب زي ما حكينا ناشونال كامبين من خلال ورشات عمل مع وزاره الصحه مع نقابه الصيادله، بالاضافه ايضا على مع وزاره البيئه لتنظيم برنامج معين، وهذا راح يكون من توصياتنا لتجميع الادويه الغير مستخدمه والمنتهيه في نقاط توزيع، ايضا عقد ورشات عمل مع طريق الجامعات ووسائل الاعلام. برضه حكون 24% تقريبا عن طريق انه يعمل سبيشال بروجرام لموضوع الانسيف او سوري السيف ديسبوزال اوف ميديسن. وبالاضافه كمان في دور كبير على الصيادله كان له 20% تقريبا برضه كيفيه او نصح الاديوكيشن والكونسلنج للمريض كيفيه التخلص من الدواء. Conclusions and recommendations. This pilot study in Naples clearly highlights need for appropriate method for safe disposal or creative guidelines for safe disposal of medicine. ولكن الداتا اللي عندنا زي ما حكينا احنا كان السامبل سايز was small. بالتالي بحاجه ايضا information valuable for furthering discussions regarding patients' behavior attitudes and provide basic for future research in determining the quantity اللي بتدخل برضه من active pharmaceutical ingredients are disposed، واللي بتدخل كمان اللي هو الجرام environment and what effects it can impose. Our recommendations again appropriate teaching of patients and cares about effects of waste medicines on environment as well as being domestic hazards, wildlife. People should not undertake medicines recycling. Also, it is forbidden by FDA. They should drop off unwanted medication in the collection points at pharmacists and hospitals and medical centers. Donating unused, unexpired medicines to other or to need is risky and should be discouraged. وهي كثير موجودة. ناخذ الدواء تروح عليه وهذا كتفيات دكتور. طيب وجدنا زي ما حكينا responsibility for unsafe disposal of medicine regarding to our study إنه وزارة الصحة يقع على عاتقها المسؤولية الكبرى. وزارة الصحة الفلسطينية سألناهم حكوا لنا عندهم نظام الكوليكشن بوينتس ولكن في فورمات معينة موزعة على الصيادلة لكن للأسف غير مطبق أو غير مفعل. وبالتالي offering free collection from pharmacists, coordinated efforts in association between Ministry of Health and Pharmacists Palestinian Association, more structures regulations by Ministry of Health and Environment Agency, more rigorous monitoring for implementation of such measures by Ministry of Health. There is need for establishing again collection points and guidelines for safe disposal of medicine. حكيت أنا بشوي وقارنا نتائجنا نسبة 60% throw unused or expired medicine in dustbin or trash. وجدنا انه كمان زي ما حكينا بكندا وماليزيا والكويت نتائج متقاربه. ولكن في اليونايتد ستيتس اوف امريكا في عندنا الدراج انفورسمنت ايجنسي بالتنسيق مع cooperation with the Food and Drug Administration والONDCB الوايد Office of Drug Control Policy انه عندهم National Drug Take Back Program، وهذا هو المهم جدا. تقريبا موزعين على كل الولايات المتحدة 4 Take Back Program، وهذا وجدوا انه 774 طن بيقيموا من ريسايكلينج او من الادويه المنتهيه او الغير مستخدمه من خلال نقاط التوزيع ومن خلال الناشونال تيك باك بروجرام. نهايه المطاف احب اشكر فريق العمل دكتور ربع عوده، دكتوره انهار العسالي عندي. Thank you very much and for your attention.
We have time for one question.
العافية. حضرتك تبحثوا في دراستكم يعني في كم كبير كان يرجع اكسباير ماتيريال للصيدلي، بالتالي الصيدلي شو بيعمل فيه؟ يعني
هو هذا اللي حكينا صحيح. وزاره الصحه عندها هذا البرنامج انه يا الصيدلي يجمع الاكسباير ديت، واحنا بنيجي كل فتره وفتره ناخذ. عم بتصير بنسمع من الصيادله سالناهم بقول لك بتقعد الادويه عنا 3-4 شهور منتهيه وحاطينها في كيس معين او في جارور معين، بس ما في فعاليه او ما فيش يعني احياء لنماذج هذا البرنامج. فاجت هاي فرصه دراسه انه برضه سمعنا من الصيادله.
وين فيهم نفس الصيدلي اللي بتساله هذا السؤال، هو بيقول لك بجيب للمواطن الاكسباير، ما حاولت تسال وين بروح فيهم؟ ولا بجمعهم؟
لا بجمعهم بكيس وبستنى من اللجنه من وزاره الصحه او من الجهات المعنيه في الوزاره انه يجي ياخذ. طبعا هذا مش يعني فعال هذا الكلام، لازم يتفعل هو الكوليكشن بوينتس زي نظام موجود في اوروبا وامريكا زي ما حكينا. ديستريبيوتد الكوليكشن فري بوينتس، ونحط كمان انستراكشنز ونعمل ناشونال كامبين برضه، حتى نعمل كونتينيو اديوكيشن للصيادله انه في كثير برضه كيف انه نتخلص من دواء معين، في ادويه زي المورفين باج مثلا لازم نتخلص منها اذا كانش عندنا برنامج او التيك باك بروجرام انه نتخلص منها عن طريق التواليت بطرق معينه. يعني حتى اذا ما عندناش برامج في الضفه مثلا، الاردن كثير شغله حلوه، من اسبوعين انطلقت حمله بهذا الموضوع وشفنا الجماعه اللي واقفين على اطلقوا عليها الصيدله الخضراء، وعم يعملوا توعيه وتشجيع للناس والصيادله بتجميع الادويه في نقاط معينه، ووزاره الصحه والبيئه تاخذها منهم وتكلفها بالطريقه السليمه والجايد لاينز
هو حقيقة يمكن يكون اقتصاديا افضل اذا نجمعهم، لانه الماده لما تكون اكسباير وحقيقة يمكن الاكتيف جريدينت بكل تركيزها شيء بسيط عن النسبه المطلوبه، فانت ممكن تعمل ريسايكلينج وطريقه استخراجها تكون اوفر مما انك تشتريها،
طبعا
تكون مجديه اقتصاديا لشركات الادويه.
لشركات الادويه وحمايه برضه للناس